In 2005, I was involved in publishing a double-blind, placebo-controlled trial which showed that the LadyCare device was very effective, in fact, in 4 out of 5 women, in relieving period pain. As the device continued to be used by many women, some of whom were what we call perimenopausal, which means they were still having period pain and were wearing LadyCare for that, but were starting to also enter menopause, so were having menopause symptoms like hot flushes and emotional disturbance. We started getting some of those women reporting back that their menopause symptoms were being relieved significantly by wearing the LadyCare. Well, this was, of course, particularly difficult to explain. We could sort of guess that wearing a device in the underwear, we could surmise why that might relieve period pain because it's in the local area. But why would wearing a device in the underwear actually relieve menopause symptoms? This was a puzzle. So we decided to investigate this further, and we studied, in an observational trial, we studied 508 women who had not worn the LadyCare device before, but yet all of them had to have significant menopause symptoms. We monitored 23 different menopause symptoms over a period of 3 months. And what we found from that observational study was that between 72 and 75% of women had significant relief of the majority of their menopause symptoms. Now, we have had, it's fair to say, a fair amount of criticism and of doubt from scientists and doctors as to the genuineness of these results. Some say, well, we haven't done a double-blind trial, or that actually this is probably just a placebo effect. So my response to those comments are these. Firstly, the original trial that we did on LadyCare was indeed a double-blind, placebo-controlled trial. And yes, we were studying the relief of pain, yet we established a clear physiological benefit of LadyCare in this scenario. Second, some of the women in the trial and subsequently have had intrusive menopause symptoms, sometimes 20 or more hot flushes a day. And some of those women have reported back to us that within 48 hours, they have no hot flushes. Now, it's a little inconceivable to think that this might be a placebo effect, given this dramatic change around. Secondly, this level of effectiveness of between 72 and 75% is particularly high for a placebo effect. So it's unlikely that this is just down to placebo. Furthermore, we did further studies where we've looked at and measured a real effect of LadyCare on the autonomic nervous system. So we have a plausible explanation from these studies of how LadyCare is likely to be creating its benefits. On top of all of this, it's important to say that in all of these observations and studies, we have never observed any side effects from women wearing LadyCare. That's a very important observation. I'm going to repeat it again. In all of the studies on LadyCare, we've not observed any side effects from wearing the device. That is as important as monitoring its effectiveness. I want to add one other response to people who question the fact that it hasn't a double-blind trial as far as menopause symptoms are concerned. We can also observe that, for example, smoking has no double-blind trial that shows that it's associated with cancer occurrence, and yet we accept this as fact. And the reason for this is that the weight of evidence, the weight of observational evidence around this supports the fact that smoking is associated with cancer. We now accept that as fact. It's not always necessary to have a double-blind trial to confirm a particular finding. So what I would argue is that all of the observations that have been made with LadyCare and the trials that have been done, there's a weight of evidence that supports that LadyCare has a real, genuine benefit, and it continues to help a lot of women. Finally, yes, I do recommend Lady Care to many patients based on, one, its effectiveness, and two, its safety. Many women are benefiting and have benefited from wearing the Lady Care who could not take hormone replacement therapy or would not take hormone replacement therapy for their symptoms. So for those particularly, Lady Care is something well worth them trying.
Lady Care Plus is a small, powerful, drug-free device that could help reduce the symptoms of perimenopause and menopause. It's used by over 500,000 women in the UK alone. Using the enhanced power Lady Care Plus may help to reduce or completely alleviate stress, hot flushes, bloating, palpitations, vaginal dryness, anxiety, and over 23 other symptoms, completely safely. Just separate the button from the larger pear-shaped piece. Place the curved face against your skin around 4 inches below the navel and attach the small button on the outside of your underwear. It is important to wear the Lady Care Plus at all times and only remove for bathing. Over 71% of women who use Lady Care Plus feel its benefits within the first couple of weeks, and others need to use their Lady Care Plus for the full 3 months. For a full list of symptoms and for more information on the Lady Care Plus, visit the Lady Care website.